Hi everyone, I'm Helen Chatterjee.
Hi there, my name's Mah Rana.
Yeah, so the project really came from the work that we've been doing within the March Network and wider with organisations like the Culture, Health and Wellbeing Alliance and many of the partners and organisations who are represented within the March Network, to really understand how those community assets, resources, organisations had responded to the pandemic, in terms of what types of resources, interventions, programmes they were now offering, how they'd adapted those resources, and then critically how participants were engaging in that. So we've been doing a whole range of surveys, desk-based research, and really critically lots and lots of interviews, linking up both with participants, including general participants like ourselves who might have been doing stuff online or going out and about and getting access to stuff that we wouldn't have normally, and particularly people who are shielding or in vulnerable categories, and then also critically working with providers to understand what their needs, what their challenges, and particularly what sort of barriers. And that's really where Mah and her work has come in, trialling really more creative approaches to really get to grips with understanding particularly people who are vulnerable and shielding and what their lived experience is.
And I think it's great, as Helen was talking about, all these resources and kind of databases coming together. But I think it's also really important to think about how these kind of adapted programs or resources are kind of delivered or used by participants, and kind of understanding what works and what doesn't work, and also understanding the needs of kind of individuals within a group, because they can be very kind of nuanced. So people might have kind of similar kind of groupings of common issues, but how you experience those can be very sort of nuanced and complex.